You a little lunch and learn because we've got EMface Eyes.
We got them
fresh from the UPS or FedEx delivery yesterday. And Christy and I are really excited to share this technology with you. We were a part of the trial, so we were one of 3 clinical sites, 2 dermatologists and 1 plastic surgeon, 30 patients total, where we were testing the EMface Eyes for clinical results. And what we found after 4 treatments, they were done weekly, it's a 20-minute treatment, which you can see I'm getting done right now, is several improvement markers that I think are really amazing. So about a 62% improvement in under eye coloration, so a brightening effect that was very noticeable in before and after photos. We noticed a 1.4 milliliter, so that's like 1.5 syringes of volume reduction in what we call the infraorbital fat pad. So this area, along with the double chin, on some patients actually expands over time, and our only solution for this under eye fat was actually a surgical correction. So this is often something that I would send to an oculoplastic surgeon if it was moderate or severe in severity, to be able to redrape the fat underneath the skin and underneath the muscle to help smooth that contour. The other option we had was sometimes helping with the mid-face, giving support and volume back, or lifting with something like EMface to try and help disguise this under eye fat herniation. But we now have the first non-surgical means of addressing what we call infraorbital fat herniation. The third thing we noticed, because you can see that these Y-shaped applicators are actually around my crow's feet area, is that the entire length of this is emitting radio frequency. So the entire pad feels warm, doesn't hurt. The lower area is actually emitting the high intensity focused electrical stimulation. But the purpose of putting radio frequency around this entire area is to build collagen and to build elastin. So we saw in the studies 1 month after the 4 treatments about a 23 to 25% improvement in the crow's feet region. So this is without toxin, this is without adding some sort of eye cream that results in changes. And so I've had this done. This is actually my 4th treatment that we're completing today. So I'm finishing my 4th. The other thing that I've had done twice now is Easy Gel.
Yes.
So we took a sample of blood, we spun it down in the centrifuge slower than PRP. We did not add any additives other than a little bit of albumin, and it creates almost an autologous fat looking filler. And this has got lots of yummy stuff from my own blog products. So it's got growth factors and potential stem cells, and we're reimplanting that in the area to help for about 7 days. They're active and help stimulate just healthy tissues. So building collagen, building elastin. So I really feel like this multi-layered approach, building back some of the collagen, elastin, and the muscle from something like EMface Eyes, and then adding some of my really procured, bespoke fertilizer back to that area. I mean, one of my PAs, Julia, noticed last week, she's like, Dr. Palm, your under eye area looks so good. What have you been doing with it? And I realized we've now had several treatments of this, and I've now given a couple months of the Easy Gel under the eye to get some improvement. So maybe talk a little bit about like what are the settings and with the machine itself.
Yeah, so we have our little EMface machine here. We now have the under eye application. We can also treat, a lot of times we'll treat the forehead and under eyes together just to sort of rejuvenate that whole area for patients, because with the forehead you actually get a little lift to the brow. So you get a little bit, you might get a little more lid. We can also treat with the cheeks or under the chin there. This one under here, we can actually help to reduce a double chin as well as tighten the muscle. The treatment is usually 4 to 6 treatments, once or twice a week, depending on the patient's schedule. A 20-minute treatment. There's no downtime, no needles, no bruising. You don't need to numb for it. You don't need to go off any of your products. It's so easy and so comfortable. Dr. Palm is just
sitting here,
nice and cozy,
trying to be the best model ever for you, Christy.
And she is. So such an easy treatment for such fabulous results. It's my favorite. I just absolutely love it.
And like I looked at your schedule today. I'm your like 4th or 5th EMface patient.
Yeah.
And I had a patient just, on the derm side, we were talking about things, and she's like, she's a younger patient. She has a sibling that had a really unexpected and unintended reaction to getting neuromodulator, neurotoxin, things like Botox, Dysport, or whatever, for migraines. And so she was a little concerned about getting a neuromodulator, which we love those.
Right.
But I think rightfully so. So she's like, what can I do about my crow's feet area? And so we talked about things like Revox, which is a product from Revision, which has a neuropeptide. And it's been shown in a split face study, where patients got crow's feet treatment with Botox on both sides, and then one side got Revox. Just on its own, and watched those patients through about 12 weeks. And what they noticed was the crow's feet were much less on the side that got dual treatment with the topical neuropeptide and the toxin compared to the toxin alone. So we talked about, what could we do if she wanted to maybe hold off on getting a neuromodulator? Well, we talked about topical neuromodulator with Revox, and then we talked about this because we can build back some of the collagen, and then we talked about giving back some support and helping to brighten that area with PRF or Easy Gel. So there's a lot. She loved the idea of us doing regenerative medicine, so building back muscle, building back collagen, building back elastin, using some of her body's own sort of ingredients to be able to do that. I think that's something that people are very much like seeking these days when they're looking at minimally invasive or non-invasive aesthetic treatments.
Exactly. Well, even on the younger patients too, it's almost preventative maintenance, which I love. This can be done for anybody, any age, whether you're trying to prevent, maintain, or rejuvenate.
Yeah, so this is, we do a lot of EMface. We're privileged that we were one of the first clinics in California to have EMface. We now have, Christy's got 2.5 years of experience with the device, and it is a frequent flyer. We were given stats about our clinic versus a typical one in California, and we do roughly about 3 times the volume of EMface compared to other clinics. So I think you truly have an expert when you have someone like Christy or Ricky administering the treatments. And we really love this, and we've found ways to combine this with our injectables and other technologies. You can see, as we mentioned before, we can do up to 2 treatment areas at a time. So with under eye, because we are moving the orbicularis muscle here, we can't do cheek at the same time because we're moving cheek muscles, our zygomaticus major and minor, and our risorius muscles, and we don't want those competing. We wouldn't want to dislodge one of the pads. Just for effect mainly, but we can treat simultaneously at the same time as the under eye, the forehead, which as you were mentioning, the forehead helps with brow position, it helps with texture of some of the horizontal wrinkles that we have here. I feel like, the eyes were the window into our soul. Back in the 1960s, a Russian physicist named Janus, he looked at how people evaluate faces. And he gave subjects photos of a person, and people were supposed to evaluate their face, and he was able to visually track where their pupils went when they were looking at a new face. Where did they go? Eye, then maybe the nose, maybe down the lips, then kind of the perimeter of the face, and then back to the eyes. Overwhelmingly, the window to our soul, how we can see, it's the only visible part of our CNS is our eyeballs that we see outside of the body. And we really subconsciously read people. It's how we read a face, it's how we read health, it's how we read age. So paying attention to the under eye and the entire periocular unit, this area that comprises the brows all the way down to the orbital rim, is super important when we think of really beautiful results, somebody looking great for where their stage in life is. And I love the idea of combining it with the forehead as dual treatment because we're kind of opening up the eyes.
Exactly. So pretty.
And then theoretically, you could treat the chin, so the submental area, along with this under eye. So really lovely. We can kind of do a couple areas at once. I think, when we first had just the forehead and the cheek applicators, when we started to get the submental, a lot of your original patients came back for maintenance treatments in the first two areas and then did the chin. And I think, we've got a list of people that have been really anxious to treat the under eye area because I think we finally have a non-surgical way of addressing this. If you look in New Beauty online, I was just on last week, or maybe the beginning of this week, with an article that came out that's describing this technology. So I think that's a really great quick read if you want to search that online, and I think we may have even put it up on the Instagram.
I was going to say it's on your Instagram too. I think it's on both of ours.
Yeah. So really cool technology. I mean, there's never been anything to non-surgically address fat herniation in the under eye. Help with just sort of strengthening the muscle, short of surgery. We've never had a way of doing that. We have ways of relaxing the muscle, which is what neuromodulators do. But really excited to see this. I wanted to show you how easy it is. I am not the most brave patient. It feels like warmth underneath the eye, and then I explain it to patients. It almost feels like Velcro, like somebody's just kind of pulling away the Velcro a little bit in your under eye areas. We're stimulating that lower portion of the orbiculars, which acts as the hammock to hold in that fat. So if we're strengthening that, that's why we're seeing some of that volumetric reduction. It's not that we're removing the fat, but we're strengthening the corset, kind of like the belt pushes the belly in.
Yeah, exactly.
So I love that idea. I just can't wait, and I'm so happy this is finally here because I feel like we got to do the study. We had to be totally tight-lipped about it. People would notice it on this machine, and our super smart people were like, "What's going on with the under eye?" So it's here. We have applicators. They're here. So if you are interested in finding out more information, our consultations with Christy and Ricky are complimentary. They're here Monday through Friday. You can either call us at 858-792-7546 or contact us through our website, which is artofskinmd.com. But easy treatment. I love that we have this. I've been a big believer in the technology, and I think it's becoming kind of a sneaker hit. I've had several patients that haven't seen me in several years, and they're like, "What have you been doing, Dr. Palm?" And short of good skincare, regular laser light, a little bit of collagen stimulator, injectable work periodically, I think this has been the real game changer for my face.
Absolutely.
And I love that we have it. We love it so much. We've got 2 machines.
We do.
Ask questions. We'll answer them. And if you're interested in finding out more from a real sort of resource that is a source of excellence and expertise, Christy and Ricky are your ladies.
Yay.
All right. So with that, we'll end our little lunch and learn. But we will have more to come.
Yes.
Okay? All right.
So
Thanks, you guys. Thanks so much for tuning in. And I'm going to have Christy sign us off. Okay?